This is actually very nice. This is exactly kind of the curve that I would expect to see here. Very nice relationship. As our forces are increasing each step, we're actually getting a requisite increase in your range of motion. Very good. I'm not seeing many plateaus or there's no deviations in the negative direction. Very good.
Hey everyone, my name is Dr. Nick Halsey with Motus Nova. I'm a licensed neurophysical therapist and neuroscientist helping brain injury survivors understand how to make functional gains after their injury. I hope this video helps you in your recovery.
Okay, well, that's good. I think, and remind me how long you've been using your Motus Hand for?
Since October 9th or 10th, I believe. We received it on the 9th, and I think I did it that
No, it was
September 9th. I'm sorry.
That's okay, yeah. So about a month in then, is that about right?
Yes.
Maybe a little bit more. Okay. Well, let's take a look here. So it's generating that report. And while we do this, I guess the question for you guys is, do you have any questions for me? Anything that I can be helpful with today?
I do. I'm
Sure.
curious as to what kind of results you've been seeing. I mean, is it a pretty sure thing, or are you having a lot of patients that are getting results? I realize everybody's different, but I was pretty encouraged after my first session. And I seem to be able to close my fists a little bit too.
Yeah.
You generally see good results with people.
Yeah, I think your intuition is and your experiences are fairly consistent. Now, Jay, I would say that I always like to think about things in distributions, not any one point, because unfortunately, that's not the way that science tells us things. But I think your experience is quite consistent insofar as you're seeing progress. I would say just from the years of, actually at this point, a decade of doing this, I'd say that you're on the more responsive side in terms of time. So I'd say that's a really good indicator. Generally, if someone is really, really responsive early on, that's a good prognosticator. Now, like as you mentioned, none of these things are perfect predictors, right? If we could do that, we'd be in good shape. But unfortunately, I don't have that ability. I'm just saying, historically speaking, when we look at individuals who are more responsive, they generally have better outcomes. And so I'd say that's a very positive factor in your favor.
Okay.
Yeah, and to your I guess more broad question about what types of things we're seeing, I think again, what your experience is quite consistent when people are seeing improvements in like the strength and the tone of their arm. Everyone says kind of tone, everyone, or not everyone, of course, absolutes are never a good thing to talk about, but many people imagine tone as being something that's bad. But when it comes down to it, all of us have tone in our muscles, right? Tone is a necessary component to how we operate in the world. And so when you get improvements in tone, and I think it's better controlled tone, right? When you're able to more volitionally control a muscle group, that is more favorable, especially on the shoulder, right? The shoulder is really dependent on muscle activation to become stable. And so if you're noticing that you're having some more stability there, that's going to impart upon you better control of your shoulder, which is probably what you're experiencing, that better control. So I'd say that is a fairly consistent process that people are experiencing as well in terms of outcomes. I think the thing that's most variable, I'd say, is the time in which that actually takes to occur. And again, there are many factors that sort of drive that difference. Chief among them is maybe time since your stroke and kind of how much rehab you're able to do and how good of quality that rehab is. But it sounds like you're kind of capitalizing on all these available options for you, and you are on the sort of leading edge of that responsiveness. And Jay, I believe you also you have your wife there too, is that correct?
Yes, Linnea.
Yes.
Linnea, hey, good. Good to see you. And well, actually, I can't see you, but I can hear you. So that's I heard it in their voice there. So that's what I was wondering. Well, good. So that's a good question then, Jay. Now, what other questions do you have, or would you like to go into an assessment, kind of see how things are going?
Yeah, let's do the assessment.
Well, good. Okay. So on your side then, Jay, would you mind hitting the assessment button for me?
Sure.
Okay. Actually, while we kind of get this set up, would you mind just telling me when was your stroke?
March 15th, 2019. about 30 months post-stroke, I think.
Yeah. Yep. Okay.
How about that?
Very good. Okay. So getting data there. I'm just going to do a quick check here. And so while you are ready to, or while you're kind of waiting there, how is your sensation in your left arm?
I can feel things like, it's not ideal compared to my right arm, certainly,
Okay.
but I can feel hot and cold
Okay.
in terms
How
of
about how about movement and pressure?
Hey, if you're finding this video helpful, please hit like and subscribe to help other brain injury survivors learn how Motus Nova is changing neuro-rehab.
movement's not terrific.
Okay.
But
Well, that'll be something that we'll check today. So don't worry about that. So as I always say in these assessments, don't worry, there's no right or wrong answer. We just need to kind of figure out what you can do. And that's what the numbers are. Okay, so first things first.
Open up the refrigerator drawer. I tried it again today and I was able to do that successfully a couple times.
Nice.
Made.
Yeah, I would actually encourage you to use your left hand and arm as much as you can. I think any task that you can do, even if you're going to struggle with it for a little bit, try it, attempt it. Because I think integrating your left hand is back into your daily life is going to be one of those key factors of getting the number of movements that you require. Right, the Motus hand is really good at kind of giving you its foundational elements, but we need to make sure that the house gets built on top of that. Where in this case, the house is our functional abilities, right? And so being able to use your hand as much as possible, even if it is a struggle, keep doing that. And then if you have to complete something, then maybe use your right hand to step into. But I wouldn't default to using your right hand. That there's that learn non-use problem that we want to really avoid or try to revert. Okay. All righty. So first things first here, let's go ahead and just try to move your hand. We're already kind of down into flexion as fairly far there. Let's try to move up as far as you can for me, up into extension. Okay. And what I would encourage you to do is also use your right hand to kind of mirror. So really try to go up in terms of as far as you can. Okay, very good. And just relax there for me. The next thing we're going to do is we're going to actually go through a quick 3-step process here. It's technically kind of a passive check, but because I have a robotic device on you, Jay, we can actually use it to detect your sensory discrimination capabilities. So I want you to actually close your eyes, and I want you to tell me as soon as you feel the Motus hand move you. Now, it's going to make a sound, so don't rely on the sound. I want you to really focus on your left hand and arm. I want you to tell me as soon as you feel it move you.
As soon as I feel it move.
You got it. And I may be trying to trick you a little bit by moving it very slow where it's not actually going to move. It's going to make some sounds. But let me know as soon as you feel it.
Now I can feel it.
Very good. Okay. So your intuition of your abilities was in fact correct, right? There was about a 10-degree deviation that we started, took about 10 or so degrees, maybe 8 to 10 degrees to actually detect that deviation. So that sensation of movement is a bit impaired, I'd say. Not absent, but a bit impaired. Okay. So the next bit here, let's go ahead and check the rest of the range of motion. We're going to get is actually a tone curve, right? Because tone is a really nice thing. It's actually just a mathematical relationship between length and force. And so we can actually calculate that. And so go ahead and do that. And I want you to tell me as soon as you feel any sort of resistance in your arm or your hand. None of this should be uncomfortable, but just let me know as soon as you feel some sort of stretch there.
Okay. I stretching my arm, hand.
Yes, please.
Okay.
Okay. Now, is it uncomfortable or is it okay?
It's fine so far. No discomfort.
Very good. We'll keep going. We'll go up a little bit more.
Okay.
This is actually very nice. This is exactly kind of the curve that I would expect to see here. Very nice relationship. As our forces are increasing each step, we're actually getting a requisite increase in your range of motion. Very good. I'm not seeing many plateaus or there's no deviations in the negative direction. Very good. Okay. Okay, let's go ahead and do our sort of third check here. I want you to try to move down as far as you can. So you'll see those numbers on the left. You're kind of at 18 degrees of extension right now. I want you to try to move that number down as far as you can go for me.
Okay.
And it may be fairly hard, and that's okay. Good. Nice work. Nice work. Good. Now, I want you to relax and try to come up as far as you can, up into extension.
Yeah, well, that one's I've been kind of struggling with. But
Yep, that's okay. That's okay. Use that left hand too. I want you to kind of do some mirroring there. I want you to just focus on those numbers. I don't want you to look at your hand. I want you to really focus on the numbers and see if you can get that up as high as you can. Good. Very good. Keep going. This is the hard part of remapping, right? Because you have the ability to do this, but it's also a matter of figuring out which configuration of neurons you have to actually recruit to get that activation again. Because it might be a different set of neurons. So we need to kind of explore that solution set.
during
So being able,
I feel like, you know, the top of my forearm is something's kicking in, I think.
yeah, yeah.
Um,
I very much agree with that. I think it is happening here, Jay. Okay, good. Now let's just do one more check here. Okay. Same thing here. I want you to just try to go down as far as you can go for me. Good. Now I'm going to take out all the assistance. You keep going down as far as you can for me. Keep going, keep going, keep going, keep going. Very good. Okay, good. Okie dokie. I think I know what our ranges of motion need to be. So I'm going to make some adjustments if you're okay with that.
That's fine.
Okay. So I'm going to bump up a couple things. And while we kind of finish up here, do you have any other questions for me that I can help answer?
Should he be doing some mirroring then during his activities, the games?
So I very much encourage that, to have that your right hand involved. I think this does one of two things. Well, it does two things really. The first one is when we can do bimanual tasks, we know from the literature that bimanual activation is going to drive a larger cortical response and is going to have a potentially better efficacy. The other thing too is it's actually a bit more nuanced. I'm actually going to use your right hand as a bit of a biomarker, where we talked about the number of repetitions that are really, really important, right? We know that there's a number that has to be achieved in order to make positive changes. But the thing is the number of movements is not sufficient. What I mean by that is it's not the quantity that matters. We also have to have the quality. And so your right hand, if you're engaging and you're paying attention to the instructions in the games and your right hand is following along, we can have a reasonable assurance that you're actually engaged in that activity because you're integrating that information and then you're executing the commands. So if for whatever reason, if you recognize that it's really hard for you or you're not doing so well with your right hand following, then that can be an indication that we might need to take a break, whether there's some cognitive fatigue happening or some actual fatigue. We would want to take a break then and maybe reset at some other point. So it becomes kind of a biomarker for us to monitor. So that's kind of a really interesting, maybe a non-canonical way of thinking about your right hand in this case. But I very much recommend that that approach. Okay. So on your guys' side, you can go ahead and hit the back button, and I think you should be good to go on your side.
On the Motus screen here, hit the back.
Please. Yes. Okay. So I'm actually doing a couple of things. I'm actually increasing the ranges of motion, but I'm also, interestingly enough, I'm actually going to decrease the assistance level just a little bit. I don't think we need as much assistance here. And this is going to do a couple of things. It's going to require you to do more work, which is good. But it's also going to make it a bit more challenging.
All right.
So not too much, but what I want you to do is go ahead and hit the home button for me. And then once we do that, we'll go ahead and hit begin therapy. And I actually want you to go through some of the exercises. I'm going to go over to my next guest really quickly, but I want you to actually play some of them. I'm going to watch the data come in and watch you play. And then I may make some modifications as I see you engaging some of these exercises. And then we can do some refinement there.
Okay, so I should hit the begin therapy button now.
Yes.
Okay.
Very good. And what you'll see, we'll jump into this first game and I'll just let you know what exactly you might see when I change something. And it will show up. What it will do is when you're playing an activity, it will pause your screen and it will say your provider has changed your settings. When that happens, just hit the play button again. Just be assured that I'm just making a quick modification.
All righty.
Okay, so let's go ahead and hit play. Yeah, is that comfortable for you?
Yes, so far so good.
Okay, very good.
This actually, I try to keep my finger, try to work on stretching my fingers, and this stretches it so much better and easier. My wrist won't even extend. Trying to push it back.
Yeah.
Yet on this, there's no discomfort whatsoever.
Good. Yeah, well, it's also not compressing the joint, right? Because the classic way we can do this is we go weight bearing, right? And you compress the joint sometimes. And so this is doing it without that.
Okay.
Okay. All right, so let's go ahead and go through these exercises, and then I will be watching the data come in, and I'm going to jump over to my next guest real quick, and then I will circle back around with you guys, and we'll kind of have a quick a follow-up in a couple of minutes, okay?
Okay, sounds good. Thank you.
Okay. Actually, Jay, I think you're muted right now, so feel free to unmute, and I'd love to hear your thoughts. Yes, I can. Yes. How's it going for you? Oop, Jay, it looks like got muted.
Any better?
Yes, much better.
Okay.
What are your thoughts, Jay, so far?
Yeah, I can't really tell much difference, but I mean, it's going well. No issues.
Good. Yeah, we're moving about 10 degrees more than before, between maybe 8 and 10 degrees more. So I think it is moving up more. So the ranges of motion have increased. So that's good. I think what we'll do is, we'll just schedule a time in the next couple of weeks to follow up, and we'll continue to track progress and increase range of motion and continue to make modifications to help push things forward. Okay.
All right. I did remember one more question.
Sure.
What kind of carryover do you see with patients after they stop using the Motus Nova hand?
Sure. I think it is exceptionally important to recognize that there can always be regression once you stop. That is something to always mention. And the thing we need to, which is why I always emphasize trying to integrate as much functional tasks as possible, because that will ensure that when you do stop using like a formalized therapeutic system, you'll have that carryover and that retention, right? But when we formally looked at this, evaluated it, we did see the carryover effects lasted around a month when we did those evaluations. Unfortunately, we didn't do long-term, like year-long evaluations. But presumably, if we're able to incorporate our use of our upper extremity back into our daily life, those tasks would be maintained and retained.
All right. I was just curious on that one.
Yeah, no, it's a really important element. Not many people ask about that retention question, but it's an important one. So.
Okay.
Thanks for watching this video. If you have questions or would like to speak with me about how you can make functional gains from home, call or text me at 404-939-3476 or visit motusnova.com/contact.